going to talk about nausea and vomiting in the next couple videos. You know, we all know many words for throwing up. Worshipping the porcelain goddess, ralphing, puking, no matter what you call it, it isn't fun or comfortable, and you can't do what we all want to do, which is to eat and drink our favorite foods and drinks. In this video, let's talk about nausea. And most people have experienced nausea at some time in their life. It's a feeling of queasiness or being sick to your stomach. It can even lead to a feeling or an urge to vomit. So nausea is a very common symptom for our hospice patients to face, and it can be bad or even worse than pain sometimes. It can just be miserable. It can cause depression, and if it's not treated, it can really contribute to weight loss as the patient doesn't feel at all like eating, and even contribute to the cause of death due to dehydration if the patient isn't able to ingest a normal volume of fluids. So addressing it has to begin, as always, with a good assessment to see if the cause can be identified. And of course, please first ask the patient if they know have any idea what's causing the nausea. Have they tried something new? Perhaps they've eaten a new food. They might have started a new medication. They've gone out and eaten in a restaurant with friends. Here are some of the common causes of nausea in our hospice patients. There can be food allergies, but in hospice care, most people and families would already be aware of that. GERD is called gastroesophageal reflux, and this is caused by leaking of stomach contents upward into the esophagus and causing nausea. Medicines, let's say they started a new medication. Did the nausea start after that? Perhaps it always begins 2 hours after a particular medication. Look for a pattern. Medical treatments such as cancer, chemotherapy, or radiation treatment in our hospice patients can really cause ongoing nagging nausea. Migraine headaches can cause nausea. And of course, last but not least, severe pain of any kind can have a component of nausea. It can be a sign of blockage in the intestines, and with our hospice patients that are using narcotics for pain management, then constipation and possible obstruction must be considered. So what to do? Here are some simple things. First thing, sit up rather than lying down. Have a bowl or basin handy just in case the nausea increases and leads to actual vomiting. Sip on some room temperature clear liquids. Try ginger ale, Coca-Cola, ginger tea, any kind of flat soda like 7-Up, or some mint tea. Always try really small amounts, like 3 to 4 tablespoons, and if it works, great. Keep up the fluid replacement, go back to normal activities. Again, once it's gone, watch for a pattern. Does it return? And if it does, what time of day does it come back? Is it associated with a particular medication or specific activities? This is going to help you know how to intervene. Change that so that you don't get repetitive nausea. In the next video, we're going to talk about medications for nausea, and then if the nausea extends into actual vomiting, we will talk about how to handle and treat that. So, listen further. Here we go, number 2 video on medications. This is Nancy with the Hospice Care Plan. This is our booklet, the Hospice Care Plan. Don't be afraid to get it. Please do, and watch more videos about how you can take care of yourself. Thanks.